Hi, I'm Dr. Arti Thangudu. Thanks so much for being here today. I'm a physician and I specialize in endocrinology, thyroid, diabetes, hormones, and metabolism. Today, we're here to talk about hypoglycemia, so low blood sugar. Hypoglycemia is discussed in the endocrinology world in depth, but it's something that I think most of us have discussed or felt in our life. I wanted to come on and talk about what is truly pathologic hypoglycemia. In diabetes, we often see hypoglycemia due to medications like insulin and sulfonylureas. There are other syndromes that can cause hypoglycemia as well, but they are very rare. So first of all, what is a diagnosis of hypoglycemia? Hypoglycemia has to meet Whipple's triad. Whipple's triad consists of symptoms of hypoglycemia, 1, 2, a low blood sugar on serum, which is very hard to find because it's not like everybody can go to the lab and get their blood drawn with hypoglycemia. So it's a very hard diagnosis to make, but we do try to at least get a finger stick blood glucose when we're working up somebody who thinks they have hypoglycemia. And 3, symptoms have to resolve with normalization of blood sugar, so by eating or drinking something with sugar in it. So the first thing to do at home if you think you have hypoglycemia is to check a finger stick blood sugar while you're having symptoms. Continuous blood glucose monitors are amazing devices, but they're not as accurate with low sugars or high sugars, so a finger stick is very, very important here. So what are some symptoms of hypoglycemia? Well, the common ones that we think of when we think of hypoglycemia in the general population are adrenergic and cholinergic symptoms like sweating, palpitations, hunger, maybe some confusion, blurry vision. Now, when we have severe low blood sugars, we have symptoms that are called neuroglycopenic symptoms. So these are symptoms when the brain is actually deprived of sugar. Our brain needs sugar for proper cognitive function. These can be seizures, coma, passing out. These are the things that we really, really want to prevent and avoid. Some patients with diabetes who are accustomed to having high sugars feel symptoms of hypoglycemia at normal levels. This tends to normalize over time of keeping blood sugars normal. There are many but rare causes of hypoglycemia outside of diabetes medications. These include insulinomas, cancers. Patients can have hypoglycemia after getting bariatric surgery. If you're having symptoms that you are concerned are related to hypoglycemia, I recommend checking a finger stick blood sugar first to ensure that you're meeting most of the criteria for Whipple's triad. And then if you do have a low sugar on your finger stick blood sugar, talk with your doctor about potential causes of that low blood sugar. So if you're truly experiencing hypoglycemia with documented low blood sugars at the time of symptoms, certainly speak to a specialist about this so they can help you navigate what is causing it. Since syndromes of hypoglycemia are so rare, your best bet may be talking to a specialist. Please don't forget to like, share, subscribe, and thank you so much for being here. Looking forward to next time.